What is Crohn's disease, and what are my options in dealing with a problem that will never go away? Crohn's disease is a chronic inflammation of the intestines. The immune system mistakes some bacteria for harmful substances, and white blood cells are signaled to attack. This causes inflammation and sometimes permanent blockage in the digestive system, in which surgery is needed to remove the built-up scar tissue that forms in ulcers. If the ulcer is not removed and continues to build up, it can puncture the walls and the bacteria will spread to other organs, leading to death. The cause is unknown, although it is shown to be hereditary. There are upwards of 1 million Americans with Crohn's, and the number continues to increase in industrialized countries. Some research suggests that environmental factors such as poor, unvaried diet contributes to those infected. The symptoms of Crohn's disease are rapid weight loss, severe cramping, poor appetite, diarrhea, rectal bleeding, hair loss, fatigue, or blood in the stool. Crohn's disease works in somewhat of a cycle of relapse and remission. The symptoms are very different for each person and vary in severity. Some may not need treatment for years, while others spend hours per week being injected with steroids. There is no cure, but medications to dampen the inflammation and weaken the attacking blood cells. My diagnosis came from a series of tests from swallowing a pill containing a small digital camera, X-rays in which I had to swallow numerous cups of liquid barium, blood tests, and a colonoscopy to figure out my aching cramps and shocking loss of 20 pounds. The doctors found my ileum so inflamed they could not take a sample for further tests in fear of causing internal bleeding, a blatant sign of Crohn's. With a father a practicing ophthalmologist, conventional medicine was the assumed road of treatment. Both doctors I visited suggested I be medicated daily. My intake was prednisone, Entecort, 6-MP, and Pentasa, 3 of these being moderately strength steroids. Because there is no published guideline for Crohn's and how to maintain control, each patient is basically forced to apply a system of trial and error with diet choices, stress levels, and dosage of medications. Because I was also taking the birth control pill, a daily allergy medication, a daily vitamin, calcium, iron, and flaxseed supplements, I was taking nearly 20 pills a day. I noticed that yes, I went to the bathroom less often, but my cramping had gotten worse and I was bloated nearly all the time. I had heaving headaches, rapid weight gain, and mood swings. I wondered what these chemicals, hormones, and steroids I was shoveling into my body were made of. Am I helping or hurting myself? And who else is affected by this medication? According to Derek Jensen's What We Leave Behind, the waste products from Western medicine are adding to the destruction of the earth. The plastic gloves, biohazard bags full of needles, test strips, syringes, medical tape, and empty IV bags that are incinerated are exuding toxic emissions into the atmosphere, affecting every living creature on this planet. Jensen also points out that the medication that is not absorbed by the body is expelled via sweat, fecal matter, urination, and spit, and is intoxifying the natural world. Steroids are 4-joined carbon rings that are commonly found in hormones and are now infiltrating water systems around the world due to heavy use of the birth control pill and many other common uses. These steroids and hormones have different and massive effects on animals, especially in fish, rendering them defenseless against a forced sex change, and they can no longer reproduce. According to Hilary White, new studies on the St. Lawrence River in Canada show extremely high estrogen and other hormone levels affecting the male fish population. Many of the male species now show a growth of female reproductive parts, including nearly 100% of the smallmouth bass population was feminized or had eggs in their testes. Not only are natural ecosystems affected by my choice to take conventional medicine, much of the medical dollar is spent on research on animals in laboratories. Humans remove animals from their natural habitat with the sole intention of using them for testing. Where does this fit on my moral compass? Francis Bacon was a huge influence in the change over to modern medicine. He spoke of the earth as a mysterious virgin with many secrets and puzzles to figure out. He reasoned that there were many untapped resources and we must take advantage of what the natural world has to offer. Without this push for the knowledge of the unknown, humans would never be as technologically advanced or have the cures to diseases as we do today. Can you think of life without vaccines for polio, malaria, tuberculosis, HPV, and influenza? These have all come from Western medical advances, as well as radiation and chemotherapy to treat cancer, antibiotics, and insulin for those who have diabetes. Most of these advances came from years of research on animals. There is now a dependence on Western medicine in our society and industrialized countries all over the world. It is more popular than alternative medicine because of the quick healing time and insurance coverage. In a culture where the most highly funded form of medicine is conventional, it makes doctors of alternative medicine harder to find. In a culture where slowing down means making less money, few take the time to nurse themselves back to health. According to Keel, 60% of all American doctors will prescribe antibiotics for the common cold, even though studies have shown the damages of creating more and more resistant strands of bacteria. The consequences on the environment and the animals that these medicines are tested on are not calculated in the price of the medicine, nor mentioned when they are suggested and prescribed. I was advised to look toward alternative medicine for different ways of coping with my illness. Yoga, meditation, dance therapy, music therapy, hypnosis, and many others were suggested to me. Instead of 4 different steroids a day, I complement the milder 2 with the guided imagery CD by Belaruth Naperstek, who guides us through a meditation to relax our digestive system, clear toxins, and bring balance to the immune system. I do my own form of dancing and music therapy and hooping. Other suggested means of healing include a nutritionist and the use of medical marijuana. According to the scientific journal O'Shaughnessy's, Jeff Hergenrather, MD, published that beneficial effects were reported for appetite, pain, nausea, vomiting, fatigue, activity, and depression. Cannabis-using Crohn's patients not only report significant relief of their symptoms, they are also able to reduce the amount of immunosuppressive medications that have been a mainstay of conventional treatment. Alternative medicine applies many different types of traditional cultures' healing methods, especially those buried deep in the roots of spiritual life. According to Keel, in prehistoric times, most of the earliest healers were women in matriarchal societies who believed disease was perceived as a disharmony in the natural world. This former way of healing encompassed treatment of the entire body, mind, and spirit. Meditation, prayers, and enchantments were used in conjunction with herbal medicines and healing practices. There was a belief that the inner and the outer environments of the body were one, and they must be in sync. This holistic view of the earth is based on a trust of healing power and energy of the earth. This idea opposes the compartmentalized culture we live in today that Jensen speaks about so many times in What We Leave Behind. Everything is in a different category. Alternative medicine is not taught in conventional medical schools. In fact, it has no clear definition. Simply everything conventional medicine is not. There's even a new category for using alternative and conventional medicine together: complementary medicine. Religion, medicine, ethics, science, plants, animals, humans, and non-humans are all separated when they are studied and practiced. In the natural world, everything is interconnected and dependent on each other to coexist. Attempting to separate these things allows them to be prioritized, which leads to an improper balance. Jensen describes a sustainable culture as one who gives the same or more than one takes. Alternative medication offers a sustainable pathway of treatment without the use of hormones or steroids. Should people suffering from diseases like Crohn's that are so dependent on stress factors and environmental conditions look to alternative or complementary forms of medication for survival?